Hi everyone, my name is Elena and this is Daily Dose of Disorder. We are a podcast that discusses all topics surrounding mental health. For our first topic, we're going to be discussing trauma. Today with us, we have a very special guest, Paola Bobadilla. She is a psychologist and a transpersonal therapist who has over 20 years of experience. I would just like to say a massive thank you for clicking on this podcast and tuning in. So, I think important to start with is defining trauma to better understand exactly what it is. So, when we look it up on Google, the first kind of definition that comes up is that trauma is an emotional response to a terrible accident. But from your years of experience, how would you define trauma and what does it mean to you?
Thanks for having me, Elena. I'm happy to be here and contribute to this important topic. I think trauma is a reality in society, and we need to address it in different ways.
Yeah.
Yes, to me, trauma is a wound. It's a psychological wound that leaves traits in the physical body and in the psychological body.
So can you maybe try and explain a little bit more? So you talked about like psychological, emotional, and physical wound. How would you describe each one?
A psychological wound it is um, it can be manifested as fear, anxiety, pain, memories from the past coming to the present and disturbing the psychology of the person who has gone through trauma.
And what would be an example of this?
Examples of trauma can be many. I could say car accident, something very common, abuse, sexual abuse, or any kind of abusive family dynamics, domestic violence, victims of war, persecution, yeah, refuge people who needs to find refuge because they in their own countries or in their own families cannot stay, cannot be safe.
And like more out of curiosity, like what are some common things that you see maybe that how people manifest these traumas? Is it through flashbacks, through maybe continuing on the abuse if they were abused before? What do you think is common to see how people manifest these emotions?
Yeah, emotions can be of all kind. We can see, for example, people with extreme pain or sadness, or they can change from one extreme to another. They can experience fear and at the same time be extremely brave and expose themselves to very risky situations.
So before when you were mentioning all the symptoms of trauma, so pain, anger, would you say these are a synonym for PTSD?
Well, PTSD is really classification given by clinical psychology. I do not work with clinical psychology. I work with transpersonal psychology and holistic psychology, which believes in the healing of a trauma. So we do not use labels to classify what people experience. Uh, on the contrary, we try to give a place and a space to those feelings and those experiences so the person can really go through every single emotion experience.
And what about medicine? Just more out of curiosity, like I know that a lot of clinical therapists they use a lot of medicine to heal, but do you believe in medicine or what is your view on the use of medicine when healing trauma?
Yeah, I know that medicine has helped many people, but I do think that some sort of medicine can cover the symptoms that a person can have, not allowing the person to get to the core of the problem.
Yeah, I almost feel like it's like injuring your ankle. Like, let's say you're playing a sport and you break your ankle, taking paracetamol would only cover the pain for X amount of
Yes.
time, but it doesn't actually heal your ankle. And this is what I think about as well with medicine. But I'm sure that it has
Yes.
proven a lot that it can be useful.
Yes, absolutely. I agree with you. It's exactly the same. If you really want to heal from trauma, you need to go to the core of the problem and acknowledge absolutely every single emotion.
Yeah.
So, and acknowledge them means that you go through them. But if a person is under medication, that person will not be able to be sad, for example. A person under medication will be flat in terms of emotions. So when you are flat and when you cannot really experience sadness or pain or sorrow or anger, then it is almost impossible to heal it.
Yeah.
The person will experience a period of recovery, but the real trauma will remain recorded somehow in the body. And it will be manifested in the future in many different ways, like psychosomatic problems are really a manifestation of not resolved trauma.
Last week, I had the pleasure of joining you here in your practice when we were doing a group meditation session. Can you maybe explain more about how your practices, such as meditation, dance therapy, really help to connect more with the body and to connect more with your emotions?
Yeah, one of the manifestation of trauma is that a person detach from the body because being in the body is too painful. So the person creates a sort of gap between. This is really interesting to explain because it's not that, I mean, you don't see a divided person, but you see a person there, but she's not grounded. She's not fully in the body. So meditation, dance therapy, art, play therapy have the purpose of really helping the person to reconnect with their bodies.
Yeah, that's very clear. And I must say, I tried the meditation for the first time last week and I really enjoyed it and I really felt calm afterwards. But I think one thing that most people are probably very curious to know and wonder about is how to deal with trauma. So you explained a bit about your practices, but what is some advice you would give someone that is going through a traumatic experience?
Yeah, this is a very interesting question because trauma needs to be addressed. A trauma cannot be ignored. So my first advice would be search for help. Talk to someone that you trust and search for alternatives. And search in many different ways and with many different therapists until you find the one that you feel comfortable with and you can feel safe enough to go through that painful experience.
And does this safety come natural? Like, let's say I'm a person who is seeking help, how can I feel attached to the therapist or the psychologist? Does this come naturally? Will I feel this connection or?
Unfortunately not. A person who has gone through trauma develops a sort of fear to be exposed, to open the wound, because the trauma is a wound recorded for a long period of time. So then the person really do not want to approach, it is afraid to also to be heard again. So safety is very important, and I would say a traumatized person would find difficult to feel safe in the presence of another one. But I would suggest to try, and that's why I say go through different, search for many options until you find that person where you can feel comfortable enough and safe enough. Yeah.
Sure, you think.
But do not make a decision from one moment to another. Or if you see one therapist and you don't feel safe, do not stop searching.
Yeah, actually, interesting enough, I was speaking a few days ago to someone mentioning that I was going to do the podcast on trauma, and they had one question that they really wanted me to ask you, and it was the difference between being traumatized or going through a drastic experience when you're young or a child versus when you're an adult. What would you say is the difference between these?
Yeah, the impact of overwhelming experience touches every person in the same way, a child or an adult. The difference lies on the way that the person deals with the trauma. So a child would have less tools to deal with a traumatic experience, will not know maybe how to identify a traumatic experience. But an adult will be able to see, wow, this is overwhelming, I cannot cope with this. And that an adult will search for help. But that's the difference between a child and an adult.
Yeah, because in my perception, I would think that maybe a child is still young, so if he would go through trauma, it would be more of a transformation process that he's doing for the healing, because he's still developing as a person, whereas if you're an adult, in my sense, of course I'm not an expert, it would be much harder to go through this process, and it would be more destruction. That's where, for example, addiction starts playing a role, the use of different substances to deal with this. Do you think this comes across a lot?
I think this is a very important point, because you are talking about the environment. When a child is exposed to a traumatic experience and the environment is a supportive and healing environment, that child will be able to become stronger and transform positively from that overwhelming experience. But if a child is exposed to an overwhelming experience and these surroundings are toxic, or he is surrounded by criminals or drug addicts, that child will have less chances to overcome it and to become stronger from it.
Yeah, I think your environment has a huge impact on how you develop, in regardless of whether you've been through trauma or not. It has a huge impact in what you see in your daily life, of course.
Absolutely, I would say that this is when these kind of events, like a podcast like this, takes so much importance, because you never know who is going to listen to this information. So then is when you see, if talking about the environment should offer enough resources to people so that any person can have the chance to heal, because trauma exists. Trauma is part of us. Trauma is everywhere in society, and we need to take responsibility.
Of course. But let's say I'm a random person and my friend is going through trauma, but how can I, as a second party, how am I able to maybe notice things in his behavior or behavior that can help me to better understand him? Or that a person is going through trauma, what can we look out for as people to maybe help out, or to notice that people are going through these things?
Yeah, some people uses very beautiful masks to cover their pain, and they are very skillful to use a nice mask and to present as everything is okay. So sometimes it's difficult to see through and say, well, this person is not well, and I should help her or help him. But one important thing that we may consider is abrupt changes in the behavior of that person. For example, we can say about a friend. My friend is extremely helpful, and he's always there with me, and from one moment to another I lose him and I never see him again. Yeah, what's wrong? have I done something wrong? And if the answer is not on your side, then that person could be that is showing.
Yeah. And how would you approach them? Would you just say like, hey, what's going on? Or do you feel that that's maybe too direct? Do they prefer having space? Like, how would you advise to approach someone who you notice is going through something?
I would say with not engaging with the abrupt change that person is presenting. So you remain yourself, you approach and ask naturally, look, have I done something wrong? What's wrong with you? And if you give him enough space and comfortability and most of all compassion, if you look at that person with compassion and love, without reacting negatively to that change that the person had, then is when the person could eventually open to you and say, well, look, I am going through rough emotions or rough changes, and I really need help.
Yeah, thank you so much, Paola, for sharing your knowledge and everything. I learned a lot, certainly. But what is maybe one last piece of advice or message that you would like to share with everyone that you find super important?
Yes. Well, thank you for having me. It's my pleasure. Yeah. What I would like to say is that trauma triggers intense suffering, leaving a wound in the physical body, in the emotional body, and also in the soul. And I would say that love and compassion are important ingredients when you really want to heal trauma. So I would say, if you are experiencing trauma, look at yourself with love and compassion and search for healing. And if you have a friend who is going through a traumatic experience or has gone through a traumatic experience, you look at your friend with love and compassion and try to lead him to healing, because healing is possible. We can leave behind all the burdens that we carry, and to have a more playful, happy, and fulfilling life. So that would be my final message.
Beautiful words, because it is true. I also believe that really as people we're able to heal. It's a very tough journey, but it's possible.
It is possible.
So one more time, really thank you. I was so happy that you were able to join us for this episode. So if you guys have any more questions or you would like to know anything else, Paola would be super happy to assist you and answer all your questions. She even has her own website, which is www.paolabobadilla.eu. I will link it down below because it's a very difficult name, as you can imagine. But she would be more than happy to contact you guys and really answer any questions that you might have after this. Thank you.